Richard, I got your text. That's awful. So sorry your Crohn's disease symptoms aren't under control using your current treatment. I'm glad to hear that you've made the decision, along with your doctor, to go for the Remicade infusions. You know, I get infused, and Remicade has really helped me to control my symptoms. And since my cousin Sean has to do a project for his filmmaking course, we decided to put together this little video to help walk you through the process while I'm on the way to one of my infusions. Isn't that right, Sean? Now, before I leave, I've got a little prep work to do. This is my pre-infusion routine. Cereal. I always start my mornings with breakfast, so an infusion day is no different. And I've just got to have fruit with my cereal. Can't forget to hydrate. I make sure to drink some water before I go. Oh, and by the way, in case you're wondering why I'm not in my usual weekend sweats, today is Wednesday, so I'm straight off to work after my infusion is over. I never leave home without this. I've got to catch up on some emails during the infusion. Now, Richard, I know you're a type A kind of guy, but you can use your infusion time just to relax. Let's go. Next week, I'm going on a 2-week trip through Europe with Michelle. You met her at the reunion? Anyway, I am so looking forward to that, and I couldn't have done it before with my Crohn's symptoms. Remicade gives me symptom control that, well, that stays with me. Before your first infusion, be sure to read the Remicade medication guide that your doctor or nurse will give you. Also, your doctor or nurse will take a very thorough medical history. This is important, Richard. Be ready to discuss your overall health as well as questions about your medical conditions. They'll want to know if you've had or been exposed to tuberculosis, had any serious infections, any cancer, any heart failure. They'll cover it all. So make sure you tell them everything. Oh, and besides asking about tuberculosis, they will want to test you for it and hepatitis B. They've got to do this because Remicade may lower your ability to fight infections. So here we are at my doctor's office. Not all doctors do infusions at their office though. You may need to go to an infusion center. Now, before every infusion, your healthcare team will want to know if there's any changes in your medical history since your last treatment, like recent travel, new medications, if you've just had a flu shot or other vaccines, allergies to medications, or any symptoms of infection you've noticed. Also, I find it works better if you schedule your appointments for the entire year. They'll start you off with 3 infusions called induction doses. After the first, they'll schedule the second one 2 weeks later. Then the third, 4 weeks after that. And then it's every 8 weeks. That's as few as 6 times a year.
Morning, Karen.
Hi, Sharon. Need to take care of answering Sharon's questions before we start. The infusion of Remicade will depend on your exact body weight. Speaking of that, I know the symptoms of Crohn's can make you not want to eat, but please make sure you're trying to get proper nutrition, Richard. Sharon is the master of infusion and has been my nurse for over a year. Sharon, would you mind walking us through the Remicade infusion process? My friend and his doctor have just decided to start Remicade treatment.
Sure, I'd be happy to walk you through the process. Just give me a second. The first thing I do is sterilize Karen's hand before I insert the needle. Then I secure it with tape so it goes directly into the bloodstream so it can go to work. Some people are infused in the arm, some in the hand. That'll be up to you and your nurse to decide. In some cases, you may also be given medicine, like an antihistamine, to prevent or lessen the chance of infusion reactions. If you're treated with an antihistamine, it may make you drowsy and you may want to have someone else drive you home. But Karen hasn't had an allergic reaction in the past. So the next thing I'm going to do is take the bag of saline and connect it to the IV. This will flush the line and ensure that the catheter is in the correct position. After that, I'll connect the bag containing Remicade.
So there you have it in a nutshell. The infusion takes about 2 hours. After Sharon takes out the IV, she will want to monitor me for a little while just to make sure I'm not having a reaction to the medication. Then I'm off to work. Got through a bunch of emails and even finished my grocery list. But you're not finished. The Remicade important safety information is next, and it is important. Listen to it because I will ask you about it. Take care of yourself, Richard. I hope Remicade can help you as much as it's helped me control my Crohn's symptoms.
Important safety information. Only your doctor can recommend a course of treatment after checking your health condition. Remicade and Infliximab can cause serious side effects such as lowering your ability to fight infections. Some patients, especially those 65 years and older, have had serious infections caused by viruses, fungi, or bacteria that have spread throughout the body, including tuberculosis, TB, and histoplasmosis. Some of these infections have been fatal. Your doctor should monitor you closely for signs and symptoms of TB during treatment with Remicade. Unusual cancers have been reported in children and teenage patients taking TNF blocker medicines. Hepatosplenic T-cell lymphoma, a rare form of fatal lymphoma, has occurred mostly in teenage or young adult males with Crohn's disease or ulcerative colitis who were taking Remicade and azathioprine or 6-mercaptopurine. For children and adults taking TNF blockers, including Remicade, the chances of getting lymphoma or other cancers may increase. You should discuss any concerns about your health and medical care with your doctor. What should I tell my doctor before I take Remicade? You should let your doctor know if you have or ever had any of the following: tuberculosis, TB, or have been near someone who has TB. Your doctor will check you for TB with a skin test. If you have latent inactive TB, you will begin TB treatment before you start Remicade. Lived in a region where certain fungal infections like histoplasmosis or coccidioidomycosis are common. Infections that keep coming back, have diabetes, or an immune system problem. Any type of cancer or a risk factor for developing cancer, for example, chronic obstructive pulmonary disease, COPD, or had phototherapy for psoriasis. Heart failure or any heart condition. Many people with heart failure should not take Remicade. Hepatitis B virus, HBV infection, or think you may be a carrier of HBV. Your doctor will test you for HBV. Nervous system disorders like multiple sclerosis or Guillain-Barré syndrome. Also tell your doctor if you use the medicines Kineret anakinra, Orencia abatacept, or Actemra tocilizumab, or other medicines called biologics used to treat the same problems as Remicade. Are pregnant, plan to become pregnant, are breastfeeding, or have a baby and were using Remicade during your pregnancy. Tell your baby's doctor about your Remicade use before the baby receives any vaccine because of an increased risk of infection for up to 6 months after your last dose of Remicade you received during your pregnancy. Recently received or are scheduled to receive a vaccine. Adults and children taking Remicade should not receive live vaccines or treatment with the weakened bacteria, such as BCG for bladder cancer, while taking Remicade. What should I watch for and talk to my doctor about before or while taking Remicade? The following serious, sometimes fatal side effects have been reported in people taking Remicade. You should tell your doctor right away if you have any of the signs listed below. Infections, like TB, blood infections, or pneumonia. Fever, tiredness, cough, flu. Or warm, red, or painful skin or any open sores. Remicade can make you more likely to get an infection or make any infection that you have worse. Lymphoma, or any other cancers in adults and children. Skin cancer, or any changes in or growths on your skin. Heart failure, new or worsening symptoms such as shortness of breath, swelling of your ankles or feet, or sudden weight gain. Reactivation of HBV, feeling unwell, poor appetite, tiredness, fever, skin rash, and or joint pain. Liver injury, jaundice, yellow skin and eyes, dark brown urine, right-sided abdominal pain, fever, or severe tiredness. Blood disorders, fever that doesn't go away, bruising, bleeding, or severe paleness. Nervous system disorders, numbness, weakness, tingling, changes in your vision, or seizures. Allergic reactions during or after the infusion, hives, difficulty breathing, chest pain, high or low blood pressure, swelling of face and hands, and fever or chills. Lupus-like syndrome, chest discomfort or pain that does not go away, shortness of breath, joint pain, rash on the cheeks or arms that gets worse in the sun. The more common side effects with Remicade are respiratory infections that may include sinus infections and sore throat, headache, rash, coughing, and stomach pain. Psoriasis, new or worsening psoriasis, such as red scaly patches or raised bumps on the skin that are filled with pus. Please read the medication guide for Remicade and discuss it with your doctor. You're encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.